Good morning and welcome to the 2023 ADAPT Community Network Family Connect Summit. My name is Linda Lall and I am the Chief Operating Officer here at ADAPT. ADAPT Community Network's mission is to provide innovative solutions one person at a time. Today's session brings together experts in a variety of topics to help you navigate supporting your loved ones. These topics include education, benefits, sibling support, healthcare, and the ability to become more independent. We would also like to thank our sponsors for making this summit possible. They include the Weinberg Family Cerebral Palsy Center at Columbia University Irving Medical Center, Sydney, Include NYC, Multilingual Therapy Associates, NYSARC, New York City Health, New York City Poison Control, New York Public Library, Start Here, and CP State. Now I would like to introduce you to Tracy Picard, our Vice President of Family Support Services, to begin today's plenary session. Tracy?
Thanks, Linda. Good morning, everyone. My name is Tracy Picard, and I'm the Vice President of Family Support Services here at ADAPT Community Network. At ADAPT, I oversee our family services program, which include family reimbursement, community rehabilitation, several housing support programs, are in our information referral line, Project Connect. Before we get started today, a couple of housekeeping rules. Please put any questions for the presenters in the Q&A. We will have time at the end of the session to answer these questions. To ask a question, simply click on the Q&A icon towards the bottom of your screen, type your question, and hit send. The chat box will only be used to post information pertaining to ADAPT Community Network. Information about translation services are also available in the chat. Please make sure your questions are general in nature and do not address issues concerning privacy. Please don't include personal information. It is my pleasure to welcome you to today's session featuring Ed Matthews, Courtney Burke, Dr. Vincent Ciasocco, and Shaniqua Freeman. Ed Matthews is the Chief Executive Officer at ADAPT Community Network and has worked in the field of developmental disabilities since 1974. He was appointed CEO of UCP of New York City, now ADAPT Community Network, in 1989. During the past 34 years, Ed has overseen the growth of the agency from supporting individuals and families in the 5 boroughs of New York City with over 25,000 families and individuals in a variety of services in 8 counties that now include the Hudson Valley, employing over 3,000 staff. Ed was named a 2023 Notable Leader in Healthcare by Cranes New York and has been the recipient of the 2022 Hausman Humanitarian Award given by ADAPT and the 2022 and 2023 Healthcare Hero Award by Schneps Media and honored by other leadership organizations. Welcome, Ed. Courtney Burke has served in a number of high-ranking positions in state government, healthcare organizations, and boards. Her positions have included Chief Operating and Innovation Officer at Healthcare Associations of New York State, Senior Vice President and Chief Strategy Officer for Albany Medical Center, New York State's Deputy Secretary for Health, as well as Commissioner for the Office of People with Developmental Disabilities and Director of Rockefeller Institute's Healthcare Policy Center. She currently serves as a Senior Fellow in Healthcare Policy at the Rockefeller Institute and is a consultant for the Sachs Policy Group. Her current board positions include Chair of New York State Autism Spectrum Advisory Committee, Trustee of the State of New York, and board member of the New York Health Foundation. Welcome. Dr. Vincent Ciasocco is a family medicine physician and medical director here at ADAPT Community Network. He has over 18 years of experience working with individuals with intellectual and developmental disabilities in various aspects of healthcare, and has been involved in leading Article 28 and Article 16 clinics, federally qualified health centers, and an accountable care organization. Dr. Siasoko is assistant professor in both the departments of family medicine and pediatrics at Albert Einstein College of Medicine and director of primary care at the Rose F. Kennedy Children's Evaluation and Rehabilitation Center at Montefiore Medical Center, where he currently works with faculty infusing IDD curriculum at the medical school. He is a Special Olympics clinical director and chair of the Special Olympics New York Health Advisory Council. And Shaniqua Freeman is a resilient individual who has overcome challenges to carve out a remarkable path of achievement and growth. From 2006 to 2012, Shaniqua has found a supportive home at Adapt Community Network residences, an experience that laid the foundation for her journey. In 2018, Shaniqua received a milestone by achieving her GED diploma. This accomplishment served as a testament to her unwavering dedication and commitment to personal growth and academic excellence. Currently, Shaniqua's educational journey continues to flourish as she diligently pursues an associate degree in communication at the Borough of Manhattan Community College and works with influential figures like DJ Whatever from iHeartRadio. Thank you to our distinguished panel, and I'm excited to welcome you all here. Let's get started. So my first question for you all for today, and I'm going to direct this to Ed to start. What are some of the issues and challenges faced by people with IDD in the current healthcare system?
You know, in the 34 years that I've been here and in the almost 50 years that I've worked in the industry, we've made enormous strides. I mean, people are living in the community, they're working in the community, they're making choices for the things they want to do. But I think what's lagged far behind is equal access to quality healthcare for individuals with developmental disabilities throughout the country, and certainly here in New York. It's been a matter of access. It's been a matter of physicians not being conversant in some of the conditions that affect people, especially with those with motor and other speech impairments, and having the ability for Medicaid to pay for some very sophisticated types of procedures and tests that people need. So it's one of the things that I think as we move forward in this 21st century, it's the next hill that we have to climb. So people still lack the access, they still lack community-based care for themselves and for their family members. So we made some strides, but there's still a very long way to go in equal access. And I think for those of us on the call and beyond, it's the thing we're really working on now as we move forward here.
Great, thanks, Ed. And Courtney, I'm going to direct the same question to you. You know, to follow up on what Ed said. You know, what do you see as sort of the main issues and challenges that people with IDD are facing in the current system?
Great. Well, I'm going to pick up where Ed was leaving off and the idea about equal access in this next phase. So I think first it's important to acknowledge the progress that has been made in the 50 years since Willowbrook, and to Ed's point, people living in the community, people having self-directed services now, employment. But I do think we're at a juncture where we need to take that next step to make sure that people are fully integrated. I've had the opportunity to work within the system for people serving those with intellectual and developmental disabilities, and also in the regular healthcare system. And there's an incredible disconnect between the two, which I think at this point in time is somewhat of a disservice to people who have intellectual and developmental disabilities, because they're not getting equal access to healthcare and they're not being fully integrated, I think, as they should be in society. So I think we have to think, how do we get to that next phase where those people who have intellectual and developmental disabilities are better understood by a medical system that in general does not necessarily understand their needs. And I think a second challenge is that there are more people who have complex needs. There's been a growing number of people with things like autism, and we need the clinical expertise to help us in that next phase. One thing I want to make sure that we acknowledge is that central to the success of people in the community has always been the direct support professionals. And we've been particularly challenged recently to be able to show people that it's an amazing career to be a direct support professional and to support them in that work. And certainly fighting for the fair wages for direct care has been an important initiative I know that Ed has been involved in, but focusing on making sure that people recognize that it's a real skill to be able to support people and do it in a way that's very person-centered. So I think all of those things are challenges for the future. So thanks.
Absolutely. And Shaniqua, I'm going to ask you like a similar question as a follow-up to, what Ed and Courtney have said. You have, your perspective on, what are some of the challenges that you've really seen and you face that really we need to look at sort of on a larger scale and need to be addressed going forward?
The thing that I really face is accessibility when it comes to going into these doctors' office, where some of them are not really wheelchair accessible, which makes my life much harder to find a proper doctor office.
Yeah, no, that's a good point. And that's a perfect segue into my next question, which I'm going to direct to Dr. Siasoko. What are the issues that you as a provider are facing that really make it hard to meet the healthcare needs of people with intellectual and developmental disabilities?
So as a primary care physician, I see everything that was just said. I agree. And those are some of the barriers to care. I think lack of training for physicians and providers to know about this field and how to take care of this field. Recruitment, retainment, that's an issue, especially. So I think a lot of that goes hand in hand. I think transitional care is also a big issue, is when you go from pediatrics to adulthood, whether it's primary care or other specialty care, it's difficult to find providers that are familiar with our population, know how to take care of our population. So I think it's very important to address some of those issues.
And, as I think a follow-up to that, what can we do to address the challenges? We've named a lot of these kind of issues and challenges that are out there, but what can be done to help address?
I think it's just educate and train wherever possible. So as a primary care physician familiar with the population, whenever, for example, I make a referral, talk to a specialist, try to get them engaged and make sure they're familiar with our patient population before, for example, if we refer them to their clinic, make sure they're aware. So I think any opportunities that would arise to provide any education and training, I think is very valuable. And there's just so much we can do, because unfortunately, training to take care of this population isn't a mandated curriculum in medical schools at this time, as well as nursing schools. So we have to somehow get that infused and get the students engaged and excited, and see how rewarding it is to take care of this population.
And I just wanted to add on to what was just said, because I think that there's a lot that can actually be learned from what the system for people with intellectual and developmental disabilities has done. And in particular, I have had an experience about 10, 12 years ago, talking to a very high-ranking government official who was in the medical field. And they said, I'd love to see our medical system be more person-centered. So I said, I think you could learn a lot from what's been done in the field of intellectual and developmental disabilities. In fact, we've been talking about new ways to measure outcomes for people that are more person-centered. For example, are they happy? If they're happy, there's usually a whole bunch of other things behind that that are very much linked to their health. And you can also ask, do they have a circle of support around them? If they say, yes, I'm happy, and yes, I have a circle of support around them, they're much more likely to be healthy. And I think focusing on life outcomes for people is a very important thing. Of course, there's reasons to focus on medical, but I think we bring something to the field that's more medical that I think we should lead with, instead of having such a segregated system. It should be more about how can they learn from what has been done in this field.
Oh, that's helpful. Ed, your perspective, on this as well.
I don't know that I can add very much. I think that, the role now we have, there are, I don't know, several hundred providers of services for individuals with disability, most of them on the long-term care side. And I think as a group of people, our advocacy really has to be much stronger than it's been on equal access and on the medical side. In fact, it's one of the things as we move forward in this part of the 21st century that we're most focused on. So I think you'll see a lot of activity on this from individuals, from providers, and from advocates across the state and across the country on the medical side. It's Medicaid is it's almost half the state budget in some cases in many states. So I think government has a great interest to be sure it's spent well and that people have equal access so that, that they get the primary and preventive care that they need. So we're not spending all of our time on the curative care and so forth.
Great. And Shaniqua, I know that, some of the issues and options that have been talked about that would be helpful are, increasing virtual appointment options. You mentioned, access as it relates to transportation. Other people have mentioned also the idea of, additional staff to sort of help, either schedule or accompany people to appointments. Amongst those topics, is there anything that you find would be like particularly helpful, or anything that I didn't mention that you think would be a great addition?
No, everything you said was good. I just like my biggest thing is just I want the comfortability when I go to these clinic offices. I want it to be comfortable where my wheelchair can go inside the room and turn around, that's pretty much all, but otherwise everything else is fine.
Okay, great. Going to address the next question to Courtney. Are there any examples, you talked a little bit about this previously, but, any examples of successful models that have been put in place in New York or across the country that you think have really helped people with IDD get access? And if you could talk about, what we could do here, if these models exist outside of New York, you think to sort of be able to tailor those to our system that we have here.
Sure. So I think any models that recognize that a person's needs may change over time, or recognizes that their needs may be more complex, and they tend to be ones that are, first of all, more person-centered. Secondly, that I think are driven in partnership with providers and families. And third, I think that they tend to not be constrained by who they're being served by, the agency or the funder. So they tend to integrate the funding and figure out ways to integrate the care. There's programs of all-inclusive care that I think are good. There are special needs plans that I think have been developed that are good. And I do like what New York has talked about in the past, and I think is still talking about now, which is some type of integrated care model for people that isn't so constrained by who the agency is that's serving the person, but rather tries to wrap the services around the person appropriately. And because Medicaid is the biggest payer, I think there's been some progress recently of people in positions in government recognizing that it shouldn't matter which agency a person is being served by. It's all Medicaid dollars typically at the end of the day. And how can we use that resource more effectively to give people better health outcomes? So integrated care that's, intensive care management. I think all of those models have shown success. And in fact, I've done some work recently to focus on individuals with particularly complex needs who may not fit neatly into one agency service system or another. There's some very promising models that providers out there are engaging in. So I am optimistic that we can have more of that, that it should be more widespread in the future.
Okay, great. Thank you. My follow-up now is, and this kind of dovetails well nicely with what Courtney was saying, Dr. Ziasoko, you mentioned the importance of educating and training providers. And I know that's, something that you have, worked on, throughout your career and have some current projects kind of going. If you could speak a little bit more about what you think needs to sort of happen on maybe an overall like policy, larger macro level, and then what the current projects are that you're working on now to implement this.
Right. So in regards to the larger picture, I think in regards to education is getting students, regardless of their discipline, medical, nursing, dental, get them at the early stages and make sure that they not only understand the clinical conditions of what the individual should care of, but also the social determinants of health. Where do they live? What's their food security? What issues pertain that are going to contribute to the quality of care that they're receiving? I think that's very important. It's also important for them to understand the existing models, as Courtney was saying, if there's other models, for example, the NCQA patient-centered model home of care. Basically, it's a model of care that ensures that a patient with intellectual and developmental disabilities gets care that's continuous, comprehensive, and well coordinated, and to take those models of care and apply it to our patient population. So I think when it comes to education and training, to incorporate all these different aspects so that the people that are being trained understand the person as a whole.
That's great. If I could ask you sort of similar question as it relates to, we've talked about some of the challenges here about, recruitment, in the field. If you could talk about, what, some of those challenges are, and then some of the trainings that you think, we could help, put into place, for our staff once we have recruited them.
Recruitment is a nationwide problem. The Kaiser Permanente staff are now on strike in several states, with several of their clinical staff because they're just woefully understaffed. And while some of the issues have to do with pay for sure, like any strike, I mean, a lot of what we heard, same thing when we had the nurses strike for a few days here in the city, is the lack of qualified professionals, particularly nurses, entering the field. We here at ADAPT and every other agency is having trouble recruiting people. Pay is certainly an issue, no matter what we pay people, hospitals and temp agencies and so forth, can pay. In fact, the New York City hospitals were almost driven into the ground with what they had to pay temp agencies here. So I'm going back to Dr. Saisoko's point, is that we really have to do a lot better job of making our field look interesting to people. I think one of the things that, we've started from a point of view that everybody understands what we do. Everybody understands, the nature of working with people with intellectual and developmental disabilities. And I don't think it's true. I think when those of us who came into the field in the 70s and 80s, when there was a lot of, idea that to give back and be socially conscious, I don't want to say you've gotten away from that. Certainly, certain parts of the population still there, but I think as a nation and as an industry, we've sort of lost sight of some of that, and I think we have to do a much better marketing job with young people, not just in the clinical professions, but in all of them, to ensure that this is a real choice, and it's a choice where you get as much out of it as you put into it. And it's like teaching. I mean, it's never going to be the highest paid industry. You're going to make a lot more money on Wall Street if you want to, but that was always true. But to where we have the jobs look interesting, the jobs look self-fulfilling, and there's room for advancement, which there is in all cases. And I think we have to do a much better job at making this a really industry. I mean, look at the advertisement that people like St. Jude's and the Shriners hospitals do. You want to donate, you have these great looking little kids on television. And while I'm not saying we repeat that exact type of advertising, I still think there's much more we can do across the country as an industry to do that. We're working with the Anchor Foundation, which is the National Trade Association for providers in this field, working on just those types of marketing materials and marketing things throughout the country to make the industry and people that we work with and look look fascinating, interesting, and not something like nursing homes where we just sort of take it for granted that they're there. And I think we can do a lot more, especially in the clinical areas, to recruit people.
Great, thank you. Courtney, I see you kind of nodding your head. Is there anything you'd like to add here?
Well, I think Ed did cover it, but it's such a crucial part of effectively supporting people is having the workforce. And the challenges have, as Ed indicated, have been national. But creating career pathways and making it showing what a fulfilling career it can be is something I think we may have lost sight of. There was such a focus during the pandemic on the healthcare workforce. But this part of the workforce is equally as important. If somebody doesn't have a good direct support professional, it changes their entire life. So it's just, I think it's the core. It always has to be a major focus. It's very important. And so whatever we can do to recruit people to show them how fulfilling it is really what we need to make sure we have the right supports for the future.
Yeah, Tracy, can I add something also? From our end, from ADAPT's end, we can always learn from others, and internally what we're doing at ADAPT, we're doing everything we can, obviously, to educate and train as much as possible. So for example, we developed what's called the HealthLink training program about 10, 12 years ago. And initially its intent was to educate and train nursing students in the area on how to take care of this population. And recently we got a grant to update the video and the film and the training. So now we're not only utilizing that to train just nursing students, but medical students, recruiters, healthcare providers of different disciplines on how to take care of this population. So that health and training program has been very valuable. When we talk about future physicians, healthcare leaders, as you mentioned, or I was introduced, through the Albert Einstein College of Medicine, for example, at ADAPT, we have first-year medical students rotating at our day programs, not learning about how to take care of diabetes, hypertension per se, but learning to understand the individual better, what supports are provided to them, learn about OBWD, so more about the person as a whole. And then in the third year, we have third-year medical students rotating at our clinics to get hands-on training on how to take care of this population, where they work directly with our providers. So we're fortunate to have those educational models and opportunities for others. And, I think we're always open to learning from other agencies and other organizations that can do the same. And we're more than happy to share what we're doing with others as well. I think the more the word gets around and the good work that we're doing here, and as I'm sure at other organizations, I think the better. I think collaboration and partnership is very valuable.
Thank you. And we can put that HealthLink information in the chat, the link. People can find it on the website. Shaniqua, a follow-up to what's been said previously, and in terms of this, recruitment and education piece, what would you say, if somebody was interested in sort of going into the field, what do you think we could do to help improve how we're reaching out and recruiting people? And then once they're here, what do you think is important for them to know as part of their training?
I really would want them to know the person with the disability, because that's the person that you're going to be working with. Don't be afraid to ask the person questions, and they will be able to answer you. And if they can, then ask their staff member or their parent. But I just want people to get comfortable with asking us what our issues may be. That's just how I feel.
Great, thank you.
Yeah, I think if I can, one of the things that, in terms of what's making it self-fulfilling, it's not, when we started it, and some of the ideas that people have about this field is the same as, they view it the same as elder care, which is essentially a palliative care, environment. And this is Shaniqua, the last thing she would want to think is that anyone's there just to take care of her as a staff person. I mean, it's if you feed a person a meal, we've taken care of them for the day. If you teach them how to cook, you've taken care of them for life. And I think that's one of the things that we're teaching people to be independent, and that's self-fulfilling for them, and it's self-fulfilling for the people working with them. And I think we don't promote that enough, that what the job is not just taking care of people, even in our own agency. I mean, if you ask somebody what they do, they help people, which is fine. But at the same time, I think it's more of a teaching role. It's more of an enabling role. And you get more out of that than just, thinking that you're feeding somebody 3 meals a day. And I think the self-fulfillment of it is really what we have to tap into for younger people and people who still find that of great value to themselves.
Yeah, and I just wanted to add.
I think that plays a big part in life. For me personally, like I have grown so much, and I like the fact that I'm very much independent. So now the next person that comes along, my goal is for them to be just as independent as I am. So that's how I see things.
Great, thank you. I know, Courtney.
Yeah, just to add on to Shanika's great point, the independence, it's something when I think about when we started this session, what does the future look like? I've always felt that it should be about a person's potential and not about the services that we're used to providing. We should be thinking more creatively about what types of different services, what things would actually make a difference in their lives to allow them to live the most fulfilling life. It's one thing to get people into the community. It's another to really help them live the most fulfilling life. And I think, we need to go in that direction. And to Ed's point about how we support people, I actually really appreciate language. It does matter. And I think using the word care versus using the word support changes how we think about things. I would never say I was caring for a person with an intellectual and developmental disabilities. I'm supporting them so that they can lift themselves up and live the fullest life that they want. So I do think that those kinds of things matter.
Absolutely. And then Courtney, to follow up, I mean, from, you're immersed in like the healthcare policy world, what, is there anything that, we should all be aware of that, are things that, we could get involved in from like an advocacy standpoint that are being discussed now, and things that either are, things we can get involved in now or should really start learning about so that, when things are developed further, that we are aware of these issues and can help move them forward and advocate for them.
Well, I know, I think there is more awareness, and the doctor talked about this earlier about the importance of education, first of all, and jointly educating people in the medical field to understand people on a different level and understand the unique needs of people with intellectual and developmental disabilities. But I also think, things like payment streams that have been segregated and models of care that can bring them together. So you're thinking holistically about a person, not just their long-term needs, because a person with an intellectual or developmental disability is going to have that their entire life. The medical system is so used to, well, we just treat it and it goes away, and changing the culture of that so they understand that no, you're not treating a patient, you're supporting a person. I think would really actually help the medical field a lot, be very much more person-centered than it is right now. And there's certainly partnerships with different organizations, and a recent issue that has begun to bring, I think, the medical field, the hospitals in particular, to better understand people with intellectual and developmental disabilities is that because of the staffing shortage and because of the increased number of people with complex needs, those people are ending up getting stuck literally in a hospital because there aren't enough services and supports in the community that can properly support them in the way that they need. And so the hospitals, in their own self-interest of trying to open up beds and get people discharged, have begun to want to better understand the needs of this population. So I think I see any challenge as an opportunity, but this particularly right now, I think that there's been some good dialogue that has never happened previously between providers for people with intellectual and developmental disabilities and hospitals.
Okay, that's great. And then Ed, as a follow-up to what Courtney just said, we have, a lot of family members, that are joining us now. We have people with disabilities on the call, if they're listening and they're saying, what can I do? How can I get involved? How would you respond to that?
Of course, there's the New York State Self-Advocacy Association, and we can certainly put information about that up in the chat for people. But I think, there's nothing but nothing gets government's ears like people speaking up for themselves. No matter what minority group we're talking about, they don't need us to do it, although we can help because we have things like data, we have things like, all kinds of history things, and we're moving into a data-driven world here for everything. So I think we have loads of data about access and loads of data about comorbidities, as they're called, loads of data about things that are of interest to doctors, professionals, and payers. But I think the best thing people can do is use their own voices and their own, meet with their own legislators, use their own voices to speak up for themselves. It's what, remember, it wasn't the legislators, and it wasn't the any advocates that closed the state institutions. It was the parents and the individuals themselves. And I think that is still the primary pathway. I think, one of the things I think, we're not nowhere. I think there's been a lot of progress made, in the last 20 or 30 years. People talked earlier about remote services and places like, with telehealth and the ability to do that. And the paying system is still lagging behind that a little bit, but that's prevented things like, but we have loads of data that shows how much telehealth for individuals has stopped people from going to emergency rooms, which is a huge cost in the Medicaid system. So I think
Absolutely.
those kinds of things are still there, and there'll be much more things that we can do. The ability for, and I don't want to talk about AI because I don't know anything about it, quite frankly, enough to talk about. But we have all kinds of smart devices now in that can help people with measure their own blood pressure, do this and do that, and find out, even as people living independently, like Shaniqua is, we have loads of ability for her to monitor herself and do remote monitoring, just like anyone else. There's so many things now that people with heart conditions, and people with pacemakers, the local hospital, be it St. Francis or anybody else, can, in a minute, if there's, your heart skipping a beat with the pacemaker, they know it instantly. And those types of data, that type of technology, which we didn't talk a lot about here, is going to be the key towards better access to medical care for individuals with any disabilities, certainly individuals with developmental disabilities.
Thanks, Ed. Shaniqua, do you want to follow up with anything that Ed said?
No, I disagree with everything he said. That's why I was just shaking my head, yes.
Yeah. I mean, are there any particular technologies that you have found have been like especially helpful? Because then we can think about, how we ensure access to those technologies on a widespread basis.
I think I'll leave that one to the doctor.
Sorry, what did you say, Ed? I'm sorry.
I was going to let Dr. Sayasoka weigh in on that one because he's, he practices in that arena as well.
There's a lot of technology out there. I agree with what Ed said. I'm not too familiar with AI, but for example, just utilizing telehealth, over these last few years and the value that's brought to individuals with DD, I think just been very valuable. And remote monitoring, I think that's key. Working in the hospital end as well as the outpatient end. And, there's a lot of communication coordination that comes out of the technology. So I think the more we can access that, I think the better. Obviously, there's a cost to it. There's a skill to it. But I think as much as we can utilize that in a good way, I think that's very valuable. And, Shaniqua, you would benefit from that if you have any experience with that. But, as you said, a cardiologist at a hospital can monitor an individual in the South Bronx, and it's just, there's a lot of opportunity out there. We just have to know how to harness it, utilize it, and train the people who are going to utilize it, how to best manage it and take care of it.
Man, I don't want to do any government bashing here. I really don't. But government makes rules to prevent abuse, not necessarily to promote good access. And I think, one of the things that even right now we're arguing about is that although some of the Medicaid rules allow for telehealth, they require either the physician or the practitioner or the patient to be in the actual clinical setting. And those kinds of things, I think, are just remnants of the past. And certainly they're trying to prevent abuse. And I get all of that. But it really, it stifles innovation. And I think, as we start to move forward, I think the biggest thing all of us as advocates can do is to make sure that we have access to both technology and innovation, because that's going to be the key to good healthcare.
Absolutely. And that does segue out. So we have a lot of questions that are coming into chat. So I think, I'm going to kind of pose this final question to each of you, and then we're going to go over to what's been coming in through Q&A. But Shaniqua, where, we've talked about a lot of different, issues, challenges, what's been moving the system forward, some of the things that really have changed for the positive over the last few years, where does the system, where does care go for here? What would you like to see as a next step?
I just want things to get better, and for just everyone to understand that people with disability, we can do a lot of things for ourselves, and that we just want you to, I'm gonna say, how do I say it? I just want people to really understand the fact that people with disability, we have a voice, and that we have the right to a better healthcare system than what it is today. So I'm hoping that it will get better in the future, like a lot.
Okay, great. Courtney, can I ask you the same question? Where do we go from here? Where does the system go? New York.
I think we take advantage of some of the things that were mentioned today, like technology, and we keep pushing the barriers as we have done in the past. And one of the advantages this field has is that there's a strong alliance, I think, between families, self-advocates, and providers. And I think bringing those groups together to say, we deserve better, we deserve more, we want the same access to medical services, we want improvements in accessibility. We're not there yet. Sure, there's more curb cuts on sidewalks and things like that, but there's still a lot of places that aren't physically accessible. And there's still a lot of discrimination, I believe, against people with any type of disability, but intellectual and developmental disabilities in particular. And that involves educating people to understand that they're people just like everybody else, and they want to live the fullest life that they can live just like them. So there's a lot of education. There's changes in regulations to make systems more current, less, I would say, compliance-based and more support-based in the future. And then, of course, we talked about the workforce as being critical for the future. And families. I mean, the families are, a lot of families are the main backbone of the workforce, and finding ways to provide respite services for those families to give them a break if they need it. And again, partnership, I think, has always been our strongest asset.
I think
Thank you.
one of the great challenges is the increase in the diagnosis of autism. And remember, autism has always been a developmental disability, but the number of people who are now being recognized as being autistic versus just having behavioral health or mental health problems has increased a lot. And I think for families and for parents, this is a huge challenge for them, as it is for us as providers. The system is overrun, and I don't want to use that word too lightly, but with folks with very high and complex needs, and we are nowhere near ready to, as providers, as medical professionals, as clinical professionals, behavioral professionals, who in the field have been dealing with people with very mild problems in terms of their behaviors, are seeing now both in our clinics and in our homes and in our day programs and in our education settings, both children's and adults, with very severe emotional problems. And I think one of the great challenges over the next, we can't wait 10 years, over the next few years, is to be able to bring in cross systems ways with the types of resources that allow us to best help all of those folks and help families deal with what has become an increasing problem here in New York and throughout the country.
Great. And Dr. Ciasok, I'm going to pose the same question to you.
Yeah, I
Here we
think
go.
one of the important things that we need to do is develop partnerships and collaborations with other healthcare entities, be it hospitals, outpatient clinics, across different disciplines. I think it's very important for all of us, whether you're a primary care physician, a dentist, is to work interprofessionally. Sounds kind of cheesy, but it really does take a village to take care of the population, and no one provider can do it by themselves. So I think developing those relationships are very important, and also using patients and self-advocates, as colleagues. When I'm teaching, I always make it a point to always try as much as possible to have a self-advocate there, because I view them as a teacher just as much as I am. So I think it's important to get them involved, include them in the conversation, the advocacy, and the education. As Ed was saying, in regards to some of the regulations for technology, having a provider on site, I think technology is great, but some of the restrictions can limit the value and the imagination that it can bring to the table of care. So that's something for, I guess, government to look at and work with our population and our clinicians and the challenges that we face to address it, so we can provide easier and better access.
Great. Thank you, everyone. We're going to go. I've got a list of questions that have come in. So thank you, everyone, for submitting them. Courtney, I'm going to address the first question for you. It was asked, are there any models of person-centered care that have worked well in other cities or countries? I know we talked about that a little bit during your talk, but are there any that you know of that may be something that we would, want to consider?
Sure. So yeah, I briefly mentioned some of them, programs of all-inclusive care. Those programs there's features of them that I think could be used, number one, because they try to think holistically about the person, their lifelong needs, as well as their medical needs. And then they allow the funding behind that to be blended and to be also more outcome focused. So I think that's definitely a good model. I think some other models, even here in New York State, that have tried to be creative in doing that as well are good models. And then there's models that have served people with higher needs that have been successful at getting them out of settings that are not integrated, like a hospital. And they have tended to focus on, let's get the person in a setting like a home, almost like a temporary respite home. Look at how they've been evaluated. A lot of times people are assessed on their worst day and not their best day. And reassessing actually how they can be supported better in the community, and then building those supports. And it takes a while to make sure that you have the right supports when that person may move out of the respite house and may move into a more integrated setting. So I do think that there are good models, and I'm a fan of those that blend funding sources so that it's no longer about the program, but about the individual.
Great.
And I also like a lot of these ones that, we brought up remote care and access. There's some new providers out there. I hope the regulations catch up with that so that it's easier to provide care in settings that might be more comfortable for people, just like everybody else in society now has access to.
Great. Dr. Ciasoko, this next question is for you. Are you aware of any postgraduate training for physicians interested in caring for people with IDD? How would you recommend someone to gain experience in the field?
Well, there are programs. It's not uniform. So, for example, different organizations such as the American Academy of Cerebral Palsy, Developmental Medicine, the American Academy of Developmental Medicine and Dentistry are a good resource. And Tracy, we can share that in regards to different programs across the state, across the country. Unfortunately, there's no one resource. I think a lot of it, unfortunately, is by word of mouth in regards to which programs are available. So, for example, there's a disability nursing fellowship state at one of the universities, St. John Fisher. Albert Einstein, Rose F. Kennedy has a special needs dental fellowship. So there are different programs, but they can be challenging to find. But they are out there. So I think, again, it goes back to networking, trying to connect with people in the field and using them as a resource to access these types of programs. And I'd be happy to to be a resource and connect the person who sent that if interested.
Okay, great. We've talked a lot here about, the importance of stakeholder engagement and involvement. So we got a question is, how do you engage people with intellectual and developmental disabilities with information around their healthcare and particular guidelines? So Shaniqua, I'm going to throw this question to you first. If you were, you or your peers were wanting to learn more about information about guidelines around your healthcare, how would you like to learn that information and be involved in the development of that sort of stakeholder group to get the information out there?
I'm sorry, I'm not too sure how to answer that question.
So the question that came from the chat, they want to know the best way if they were going to involve advocates, people with disabilities in the development of guidelines to educate them, for them to learn about their healthcare. What would be your recommendation for how best to ensure and gain their involvement?
I guess you would start off by having like your care manager help you out with that type of information first, and then they can guide you directly with more information after. So I would definitely say go to your care manager if you have one first.
And if you were being recruited or asked to kind of participate in a group that was developing that information or looking at how to get that information out, if there were other groups and organizations that wanted to reach out to advocates to get them involved, what would be your recommendation for how to do that?
I guess
I guess I can follow it up.
Each county in the city, anyway, each borough in the city has a local DD council.
Mm-hmm.
And I think you probably it's co-sponsored by the New York City Department of Mental Health, Mental Services, and the provider organizations. But I think people can get loads of information and have loads of contacts and different resources by attending those meetings. And we can certainly give people information on it. We can certainly post it on our own website or in other places as to when and where. They start up again in the fall. They're dormant for the summer, but they meet mostly monthly, and they have loads and loads. And basically the entire meeting is for information sharing and ability to get involved in various aspects of advocacy and information. So I think as right here on our own family staff, your staff can get information on everybody here. We can put that on our own website as to where the Bronx, Staten Island, Queens, Manhattan, and Brooklyn DD Council meetings are and where.
It's a great suggestion. We'll put all the resources will be available in the chat, and then we will be disseminating a QR code with everything that's mentioned in an email after the meeting. So if you haven't had a chance to take note, don't worry about it. We'll be getting that information out. We're close on time, so I just wanted to ask, as we're closing out, we do have several other questions. And again, if we didn't get a chance to address your question, we will be following up with them in the chat going forward. And with 1 minute left, I just wanted to give you sort of the final word, on the future of healthcare and, what you see as sort of next steps and to follow up.
Look, I think, and I monitored several of the questions in the chat. Some of them had to do with care management and integration, and how do we get care managers and other people to talk to each other. Courtney and I particularly have touched on this, but right now we have a very segregated payment system, a very segregated way of looking at services. You have a provider that provides DD services. You have a care manager that focuses mostly on that. And when we created the CCOs in 2018, and when Courtney, when she was commissioner, created the first integrated service plan Partners Health Plan for people with developmental disabilities in the country. It was to be able to demonstrate and forecast how an integrated setting and integrated services and people being responsible, not just for residential here, day over here, medical over here, clinical over here, how that would really help people get better at the end of the day, not only reach greater independence, but to get better care. And I think we are going to move towards that system. We are moving slowly, obviously, in the state of New York, but we move towards that system with fits and starts and mistakes and gains, that when it's fully integrated, you're going to find a much more effective system for people throughout the state of New York.
Great. Thank you. I'm going to thank all of our panelists today, Ed, Shaniqua, Dr. Sissoko, Courtney Burke, for joining us. It was a great discussion. Thank you for the engagement from everyone that was here. I just wanted to let everybody know that in 5 minutes, we will have our next session coming up. I hope everyone will stick around. We will, at 11 o'clock, the next session is addressing parents' fear of early childhood education. Also, for following today's summit, you will receive an email with a link to a survey. If you could please complete it, and you will also be entered for your chance to win an Amazon gift card. So thank you to all of our panelists for a great discussion and for joining us today.
Thank you.
Thank you for having me. Have a nice one.
Bye.
Thank you.
Bye.